So I might just take you through as a recap of the cases over the last day and also describe some of the issues that are causing us concern at the moment. So there were 10 locally acquired cases to 8 p.m. last night, and there were 3 new cases. So the vast majority of those cases yesterday were pleasingly in isolation for the full infectious period. However, we've had 2 cases yesterday that were not. So that was the 9-year-old child that attends the St Charles Catholic Primary School. And also we've had a gentleman in his 30s, and he attended the birthday party. In terms of the cases today, we had 13 locally acquired cases were reported after the 8 p.m. cut-off last night. 8 of these cases were linked to the birthday party in West Hoxton, attended by the previously reported case, so the worker at Bondi Junction. So just to describe the sequence of events so you can understand how quickly transmission is occurring. That party and gathering occurred. There were about 30 people in that gathering in a house. The person was obviously infectious at the time, unknowingly, did not have symptoms at that time, was unaware, had not attended any venues. In that evening, then went and got tested when they developed symptoms the next day, and we got the result on the Monday. Immediately, people were asked to isolate, and then we've got the tests that have been coming in associated with that. And what you can see is that those test results indicate how rapidly the virus was transmitted in that circumstance. We've got 10 cases from that party, and that's on day 2 after the exposure. So the event happened on Monday, and those individuals were tested on Tuesday. And remember, there is a period where they would not have been infectious on the Sunday, but all of those individuals would have unknowingly had the infection for periods of Monday, and that's why contact tracing is occurring related to a number of their movements. In addition, we've had one close contact of another previously known case, and that person's been in isolation for the full period. But then we've also had 4 overnight cases that we are urgently investigating. We know that all either reside or work in the southeastern Sydney area, so that does give us some comfort about the geographical spread of it. But what it means is that there is clearly cases that have been unrecognised in that area. And I know the symptoms of COVID can be incredibly mild, and some people can be asymptomatic, and hence we've wanted to call out and get those high testing numbers. Can I thank everyone for those high testing numbers? That's been essential. And if we're to get on top of this outbreak, maintaining those high testing numbers is going to be critical, as well as in following the public health orders. I just wanted to reiterate some advice, particularly in relation to Westfield's Bondi Junction. We've asked anyone who has attended from the 12th to the 18th of June to get tested, and we're specific, and that includes the car park, and particularly at the Fitness First there at any time between the 12th of June and 18th of June to get tested for COVID. It is critical. We have had a case that has frequented that facility, and it is important that we detect any crossover that may have occurred there given the nature of the transmission. There's also, New South Wales Health is asking anyone who attended the Wallabies Thai restaurant in Mascot between the 19th of June, between 11:30am and 12pm, sitting inside or outside, to please ring the contact tracing on 1800 943 553. If we could also ask people to isolate whilst they're getting onto the contact tracers, so they can get the specific advice related to their circumstances. So in summary, we've moved from having our cases all in isolation to unlinked cases. So in relation to the 9-year-old child, to date, we have not identified a source, but testing is underway. So it's not the usual source that could have been a household contact at this stage, or the other household members have tested negative. So our investigations into that case are continuing. So the cause for concern is that we have had people infectious in the community unknowingly. The party's obviously led to a number of infections, but can I thank the response in southwestern Sydney, the cooperation of those businesses impacted, and we're confident that if people could be alert to the website, we can bring that risk and threat under control. Our major focus is in this southeastern Sydney broad area, including the CBD, to make sure that we have picked up any unrecognised transmission. There's obviously been some strains of transmission that have had the ability to amplify, and we need those high testing rates and everyone to follow the public health advice.